Hi, this is Deborah Atkinson, the Voice for Fitness. If you're ready to change the way we age, stay tuned. I'm about to show you exactly how you can take someone at any ability level, take a basic assessment and modify it so it's appropriate for them, look at it and interpret what exercises we need to include in their exercise prescription and how we would modify them so that it's doable if you're working with them one-on-one, but of course doable within a group. It's something that appeals to a wide variety of both personal trainers and physical activity assistants. So watch, listen, and get ready to change the way we age.
So here I have two people, one 65 years old, the one in front, and one 87 who's following from behind. And just have them doing a simple roll down and roll up. Articulation of the spine is what we're looking at. So you can see big differences, but this allows me to easily eyeball more than one person at once. As long as I'm looking at a side view, I can see what's happening. I can see who's more or less impatient as well. But watching one at a time ideally will be a little bit easier. So you may have to have, you've got three people in line, have them roll up and down 3 times. You'll catch nuances in your eyes, small details possibly when you watch them will come to you much better, but you'll still see some big bold things happen. So you can see in the red shirt, the 87-year-old, definitely much more flat areas through her back. So spinal articulation and mobility would be a big focus. In the front, 65 still could use a little help, but doing fairly well. So looking at prescription will be easy, now knowing. So for the 87-year-old, one of the things I decided to do was a clock matrix on a wall. So she began with her arms both pointing up at 12 on a clock, and now she's threading the needle, reaching toward her left side with her right arm. Her hand was back there as she was telling me where she was feeling it. She's feeling a stretch. She's not feeling stress, but I did ask her to let me know what feedback she was getting from the exercise. And importantly, that's actually good, because if she pointed to that area between about her bra line and the top of her jeans, that's where her back was a little bit more flat. So we definitely want some flexibility in forward flexion and in back extension for her to help with that flatness of the back. But this is one way to begin it. So rotation is also very important. She's still driving a car, so making sure that she can rotate very well one direction and then the other, loosening up her back in directions that she's probably a little bit more mobile than up and down articulation. So I will show you next how when she was on all fours trying to do a cat back, that's much more difficult for her to do, understandably, because that's where she's not got control. It's where she needs to work, but what will come slower for her. So this is one way to get her warmed up, wake those muscles up a little bit so that when she comes back to cat-cow back and that type of movement that she desperately needs, it will begin to come together a little bit easier for her.
You can let it go with your body. So it's probably more comfortable.
So here we take her to a cat-cow back, really trying to get her to round her lower back up. And as you can tell in watching, she has a hard time with this. First, the coordination is something new. She's not done it and she's confused. So it's a matter of needing to probably see it, needing to, ideally, I'm going to probably take her next to the floor to do a bridge and have her begin rolling up that way to gain the control and the feel of that articulation, and then bring her back to this spot. It's more difficult on all fours than it will be lying down on her back, knees bent, doing a bridge and rolling up and down through the spine. She has a hard time here feeling it because that is exactly where she's having problems, and those muscles are dormant. They're not used to engaging.
And if that was helpful to see those assessments, the interpretation, and the suggestions for what the exercise prescription would be to progress someone from where they are now to a more stable, more strong, and more thriving active aging individual, then you're going to want to click either right up here or the address URL scrolling along the bottom to get in on Active Aging Secrets. So you're on the mailing list for tips on a weekly basis that take brand new research, and there's a lot of it coming into my inbox, that takes that research and turns it into practical information that you can use, either for yourself or to change the way someone else ages. Whether you're a personal trainer or you're an activity assistant working in a retirement community, this will help you make a big difference on the quality of life as we age. So click there, and I'll see you there.